Bismillahirrahmanirrahim. Let me discuss again certain basics related to the terminologies which will be used in the first lecture. Okay, so ventilation refers to the process of respiration, mechanisms of respiration, that is air goes inside, that is called inspiration. That is called inspiration, air going inside the lung, and air coming out the lung is called expiration. Some say called exhalation. Okay, so you can use any terms. So when the air goes inside, we need good trachea. This is they give a bronchus, and this is the lung. Okay, now we have heart here. This is left atrium, this is left ventricle, and this is right ventricle, right atrium. Okay, now from the venous side, okay, let's draw the pulmonary trunk, bronchopulmonary tree. Okay, so we have two lobes. Okay, and they give branches like this, and they form alveoli. Okay, so for easy explanation, I'm putting alveoli little bit big. Okay, so there are multiple alveoli inside. Okay, now these alveoli are surrounded by the capillaries, right? Are surrounded by the capillaries. So this capillary comes from right ventricle, because right ventricle sends the blood to the aorta, sorry, pulmonary artery. Right ventricle send blood to the pulmonary artery. Okay, now that is a deoxygenated blood. The pulmonary artery brings the deoxygenated blood and then enters the lung. They enter the lung. Okay, now they enter the lung and they become small, they give branches, they become small arterioles then. Okay, and they completely surround the alveoli, completely surround the alveoli. So I draw alveoli in green color so you can able to differentiate. So this is alveoli. Okay, alveoli. Okay, now the capillary pulmonary capillary winds the surrounds the alveoli and they come out as a pulmonary vein. They come out as a pulmonary vein. Okay, and they enter the left atrium. Okay, likewise it happens in the other lung also. Okay, so just we take one example of the right lung. Understand? So the deoxygenated blood comes from the pulmonary artery. Okay, these are all deoxygenated blood. They come, give branches, small arteries are formed, and they go to the capillary, and here they get oxygenated. They get oxygenated and come out as oxygenated blood into pulmonary left atrium. Okay, now what happens is the air comes inside. The air comes during the process of inspiration. They go into the alveoli. Okay, and the exchange happens. Then exchange happens. Then the air goes out. The air goes out during the process of expiration. When the air goes out, consider alveoli as a balloon. Now air is entering the balloon. When air enters the balloon, okay, we use different color. When the air enters the balloon, okay, what happens? The balloon gets bigger. Okay, the alveoli dilates. Alveoli dilates. So alveoli gets stretched. Okay, that is called compliance. Okay, that is called compliance. So alveoli get stretched. Okay, so stretching property of the alveoli, stretching property of the lung is called compliance, lung compliance. Okay, so because in certain diseases lung compliance is affected, they cannot able to stretch. Okay, so and the air which going out of the lung, expiration, air, after the gas exchange the air goes out. Okay, air circulates, so that's why they call it as a ventilation. So air goes out. When the air goes out, expiration happens. When there is stretch, that is lung compliance. After that, because alveoli has elastin connective tissue, so that recoils back. So then they come as a recoiling. So that is called elastase property. That is called elastase property. Okay, in some disease that recoiling is affected. That recoiling is affected. Lung can stretch, but they cannot send the air out. Okay, that is affected. Okay, now normally when you are sending air inside the balloon, okay, now the balloon is stretched. Then if all the air comes out, what happens? The balloon becomes squeezed, right? Collapse. So if all the air goes out, the alveoli get collapsed. To avoid that, because we need alveoli in a, it's like a sac, it should not get collapsed. So to keep alveoli in a sac position, so the all the air which goes out, all the air which comes in is not going out. So some amount of air present in the alveoli. Okay, there will be after expiration you can see some amount of air which is present in the alveoli to avoid the collapsing of the alveoli. So you can call this as residual air. It is called as residual air. Okay, and this residual air is very important. What you can call this air as residual air. Okay, this air is very important. Okay, when all the air goes out during expiration, some amount of air is left out to avoid the collapse of the alveoli, because alveoli has to maintain in a sac shaped. Okay, so this is called residual air. Okay, now when the oxygen is taken by the blood, okay, when carbon dioxide goes out, I mean goes is taken by the alveoli, and oxygen comes to the blood. Okay, this is called, this will increase in the arterial blood. Okay, in the oxygenated blood which is going to the artery. So we measure the oxygen, that is called partial pressure of oxygen. Okay, it should be 95, at least it should be 95. Okay, so this is measured by a machine called pulse oximeter. If you go to the ICU, you can see the patient finger is clipped as a clip. That clip is called probe, that measures the oxygen level in the peripheral blood. It should be 95, because it is after oxygenated, the blood partial pressure oxygen should be 95. Okay, so when the carbon dioxide goes out, understand, and the oxygen comes to the when the oxygen comes to the blood, so the partial pressure of oxygen should be 95. So this is called ventilation perfusion. This is called ventilation perfusion. So if they have 95 oxygen in the peripheral blood, then ventilation perfusion is good. If that is balanced, that is carbon dioxide going out, oxygen coming back. If the oxygen level is reduced, okay, then the ventilation perfusion is becoming imbalanced, which means they are not getting the oxygen, they are not sending the carbon dioxide. So instead of carbon dioxide is increased, so oxygen level is reduced in the blood. So it is called ventilation perfusion imbalance. Okay, so normal ventilation perfusion is called ventilation perfusion balance. Okay, so what happens here is, in certain diseases, this ventilation perfusion becomes imbalance. Okay, so you should keep that in your mind. So one ventilation perfusion is having good amount of oxygen. Okay, so if partial pressure of oxygen is reduced, we call that as arterial hypoxemia. Arterial hypoxemia. Arterial hypoxemia. Arterial hypoxemia. So this is another terminology. So these are the terminologies you should understand, because if you understand the mechanism of respiration, you will understand this terminology. Okay, so once again I summarize it. When the air comes in, that is called inspiration. When the air goes out, it is called expiration. When the air goes out, all the air is not going out, some amount of air is inside, because to avoid the collapsing of the alveoli, that air is called residual air. So in the physiology they will discuss about residual volume, inspiratory residual volume, expiratory residual volume. Inshallah, when they take, you will understand more. But for pathology lecture, this at least you should know these concepts. So it is called residual air, and this residual air is very important to avoid the collapse of the alveoli. Okay, now when the oxygen comes in, carbon dioxide goes out. Okay, that is called ventilation perfusion. And how we measure that ventilation perfusion? If the peripheral oxygen
partial pressure of oxygen is 95, ventilation perfusion is good. If the partial pressure of oxygen is reduced, ventilation perfusion is imbalanced, ventilation perfusion is imbalanced. So the arterial oxygen is reduced, then it is called arterial hypoxemia. Okay, so the ability of the lung to stretch is called compliance, and ability of the lung to recoil back, that is ability of the alveoli to recoil it back, it is called elastase property. Okay, elastance. Okay, so you should understand these two terminologies. Certain diseases affects the compliance, certain diseases affects the elastase property. Okay, so let's finish this basics now, and inshallah let's go to the lecture.